Thank you for joining us this evening, either on YouTube or here at City Hall in person. We are delighted to have a panel of folks who are going to be addressing substance abuse and the issues of substance abuse in our community. It's been a topic of concern of the public, and we brought together a group of folks who represent all the different agencies in town that are dealing with this on a daily basis. So with that, I want to introduce the panel and allow and ask each of them to talk a little bit about the services that are available in Cordova to help people who are dealing with addiction, or to provide resources for family members and community members who want to know what they can do to help. So I'm going to pick on one or you. Who wants to start? Barb, would you like to start? Barb Jewell, who's with Sound Alternatives, and she's going to give a little introduction to what it is that Sound Alternatives provides.
Sure, thank you, Helen. So I'm Barb Jewell. I am the Director of Community Programs, and in that position I oversee the behavioral health programs. So the services that are provided to serve people with mental health and substance use disorder needs. We provide assessment and treatment, which means that people can come in and ask questions to find out if they have a problem, and we help them identify what level of treatment that they might want to pursue. We provide individual, family, and group therapy, as well as providing what are called recovery skills services, supporting people in developing the skills that they need to deal with their stressors better and avoid alcohol and drug abuse. Those services can be in the center or in the community, and it really is designed to serve the individual needs of the person that is there asking for services. We take referrals from the court system and probation, as well as any individual that walks in the door. We can assist with referrals to higher levels of treatment, and in fact frequently do that. So we will help people find treatment at inpatient and residential services as well. And we refer locally to Alanka for their MAT program, to primary care providers, and to anyone else who can assist people with their substance use concerns.
Thank you, Barb. I want to move on, since you mentioned Alanka Clinic. If we could have Dr. Utsi and Susie participate here and talk a little bit about what the Alanka Clinic is able to offer.
Sure, thank you. Very similar to what Sound Alternatives is doing. We have individual counseling for folks struggling with substance abuse and or mental health. Often there's a co-occurrence there, as well as their families, and we can do couples counseling as well. We do assessments to help folks get a sense of what their struggles are and what level of care they might need, and facilitate referrals to inpatient treatment as well, if that's what they need and what they're looking for. We have a medication-assisted treatment program, so we collaborate. Myself, I should have mentioned, I'm the behavioral health coordinator. My colleague, John Yakinak, is a behavioral health clinician. He's wonderful. He's not here right now. And Dr. Utsi and the other medical providers. We work together to integrate our care the best we can so that we have the behavioral health and the counseling component, along with any medications that might assist. So when it comes to substance abuse, with opioids, we have a Suboxone program where folks come in and jointly meet with Dr. Utsi or the medical team and us. And if they're the right fit, we've got a program agreement and contract. There's a lot of responsibilities on their end, and we have a group component as well to help them with their opioid addiction. We also have a lot of medications for alcohol. Dr. Utsi, I'm going to kick that to you.
So we have help with alcohol and other substance abuses as well. Mostly it's the alcohol. I'm researching and we're looking into ways to deal with meth abuse. That's kind of a big deal because we don't have any real good medications yet for that. But for alcohol abuse, we have up to 4 different medication options after you get done with detox. And we can help with home detox or getting you set up with a detox center up in Anchorage in order to be able to help get you off the alcohol to start with, because it can be a dangerous thing to do.
Couple more things is we have a recovery circle every Tuesday night, 7 o'clock to 8:30 at our wellness center in the basement there at Alanka. Not these next 2 Tuesdays. The next one will be September 28th, but that's open to anybody in the community struggling with any sort of substance use difficulties. You don't have to register, just show up. We also distribute Narcan kits and fentanyl test strips, so anybody can just call or come in and we can get people connected with those.
Great, thank you. Dr. Sanders, if you wouldn't mind sharing a bit about what CCMC does and offers the community in terms of, I guess, treatment and emergency response.
Great, thanks. Is that picking up a little bit better? There we go. So I'm Hannah Sanders. I oversee the hospital. The hospital has involvement in kind of all of these programs at some point. I like to think of substance abuse in kind of 3 different areas. The first is prevention. I think prevention, the hospital clinic, is our role with the providers, and then sometimes with Sound Alternatives in Alanka, we're going to identify people that are, whether it's socioeconomic risk or have behavioral risk that maybe are going to put them more at risk for substance abuse, and helping to identify those people, providing early education to whether it's pediatric patients or people that are high risk, and also limiting our prescriptions of narcotic medications. So that's been a big deal for the state of Alaska and for our entire country. I hope that our population here is seeing that over the last 5 or 6 years, Cordova's access to prescription medications has significantly declined. We are only prescribing really what we see as an absolute need. And then we have drug take-back programs where people can bring their medications in, or have these packs that Alanka has been very amazing about distributing through town so that people can destroy their medications. The next piece is harm reduction, which we talked about that just a little bit, but we have Narcan test strips and the naloxone that's been distributed to many areas in town. We're hoping to continue to get people access. The Narcan test strips, a lot of people have concern that that might be encouraging use. Sorry, did I say Narcan? The opiate, the fentanyl test strips. Really, the studies have shown that that does not increase people's use, but it helps to make it safe. So that users, they don't use because they are wanting to harm themselves, right? There's a different problem going on. And if they can check and make sure that they're not going to harm themselves, that they'll likely survive the time when they're using, if they can identify the fentanyl ahead, then they don't use, or maybe they use less, or use in the presence of Narcan. We're also distributing Narcan so that if people or friends identify somebody that's had an overdose, they can get started with that early intervention. But that brings us to the emergency room piece. So when somebody comes in an emergency, the hospital is ready to take care of them if it is an overdose from opiates or alcohol, which wouldn't necessarily be an overdose, but a life-threatening thing with alcohol is to withdraw from alcohol. So we can hospitalize people here in the community for alcohol withdrawal. Most of the time, we're able to keep people in the hospital and do their detox in the hospital. And as they're getting through the detox, then we will get them tied into programs like Alanka or with Sound Alternatives. Occasionally, somebody has such a severe detox that they require ICU admission. And so there are some cases where we have to medevac people to Anchorage. But the hospital is always primed and ready for that response. So appreciate all of our partners here in town and glad to have everybody here at the table.
Thank you. So we've heard from the medical side, the intervention, prevention side, and then at the end, we had to deal with law enforcement and the court system. And here today we have Mark Hoover with the NVE tribal courts, and Nate, obviously our chief of police. So Mark, you want to talk a little bit about the programs that you guys have within the tribal court system?
Well, we've been at this for like 27, 28 years now. We started the sobriety celebration here in Cordova, and are trying to figure out how best can we alleviate some of these problems that people are having. And it came to us that it was a cultural and a spiritual and mental health issue, more so than the substance abuse was like a symptom of what was going on with the individuals. So that's kind of been our overall goal. I think it's been having some effect on the community. There's the sobriety celebrations have been really big and dealt with culture, dealt with all different aspects of the trying to figure out the situation. So yeah, the populations are dealing with PTSD. In almost everything you hear now, that comes up as something that's a problem for people. And I'm trying to figure out, maybe starting with the youth, real young, getting them involved with cultural ideas and hunting, all of the things that are happening here for people have existed here for thousands of years on the land and the relationship with that. So that's kind of our overall look at what's happening here, and I'm glad to see that everybody's here to discuss this, and it's really important for the community.
Thank you. And Chief Taylor.
Thank you. And as Hannah was saying, our role in most of this is the emergency side. We're usually the ones that see it before it ends up in the emergency room. And in that regard, a lot of what we do is just try to keep people safe in the event of, say, drug overdoses or alcohol issues. Our job primarily around those is keeping people safe, either keeping people in the community safe or keeping the people who are actively abusing or addicted to those substances safe from perhaps even themselves. So oftentimes we're called for those situations where perhaps somebody is experiencing, excess alcohol consumption, and that's endangering themselves. They've reached that point where they need some intervention from somebody, and a lot of times we're the ones that get called for that. But we rely heavily on our other partners here because we usually hand them off in those types of cases. In the realm of drug addiction and drug abuse, obviously we are also the hand of the law. We try to administer the laws that are written and enforce those laws, while at the same time the law even is designed around restoring people. So even when people get in trouble legally for things that are against the law's goal in the end is to try and restore those people, especially first-time offenders, youthful offenders. Those types of folks are generally given the opportunity, even through the court systems, if that's where they come in, to redeem themselves communally and through programs. They're often given chances to go through, they're often ordered to treatment and that sort of thing as a result of perhaps some crimes that may have occurred on that end. But obviously we're the emergency side along with the hospital, and then all the other folks sort of come after that to pick up that and continue it through hopefully restoration in the end, and somebody who's no longer abusing and or addicted to the substances which once held a sway on them.
Thank you. So in advance of this meeting, we did solicit questions from the community, and I'm going to kick off with a few, and those in the room, if any of you has a question, just raise your hand and I'll bring you the mic and you can ask it directly. And to the panel, I'm going to let you all decide who wants to take each of these questions. They run the gamut. I have over 20 questions. We may not get to all of them tonight, but I look forward to hearing some responses because they're questions that the community has. I had a number of these questions in my mind as well, so I'm looking forward to your conversation. So the first question is, how can you tell if someone has an addiction? What's the difference between casual use and abuse? Does anyone want to tackle that question? In 20 words or less. Just kidding.
Yeah, I'm sorry, this is not a Twitter answer. So people who use casually or even heavily may not be addicted. The difference is that when somebody who's using casually or even heavily, ends up with a problem, whether it be medical, physical, legal, whatever the problem may be. If their relationship starts falling apart, they stop using. They put it down. They don't pick it back up. The problem with addiction is there's a certain percentage of people out there that are unable to put it down, even if it's killing them. If it's driving them to destroy their entire lives, their relationships, having to leave home, move, losing kids, getting multiple DUIs, that sort of thing. Everybody makes mistakes at times. And so that's kind of the big difference between somebody who's addicted and somebody who's just a casual or heavy user even, is people that have problems stop, or if they're unable to stop and they keep coming back to it, it's an addiction.
All right, thank you.
There's also one more thing on that.
Sure.
So addiction can also be physiological as well. So your body can have a tolerance and addiction to it, and you will go through withdrawals if that's the case. If you're a casual user, a lot of times you don't have that withdrawal effect as much. Most of us have experienced that at some point in our lives when we have a massive hangover from drinking too much. That's actually a withdrawal symptom. That means that we've way overdone it at that point in time. You may not be addicted, but if you have the genes for addiction, you're putting yourself in a dangerous situation.
Does anyone want to add to that? Or I do have a question that's sort of related. Do addicts choose to use? If a biological addiction develops over time, when is it too late to stop? Yeah.
I'll start with this one, and I'll hope that my colleagues will jump in. I would say it's never too late to stop, right? Every day is a new day. But that being said, the longer you go, the harder it is. I really appreciate Dr. Utzi's description of addiction as opposed to use. We really do look at functional impairment, right? So if your use of a substance, whether it be legal or illegal, is impairing your ability to take care of your day-to-day needs, or worse, you start to need to be worried about that use and your dependence, if not addiction. And again, every day is a new day, and it is never too late to stop.
Great. Again, if anyone in the audience has a question, by all means, just raise your hand and I will call on you. So what percentage of our police calls are drug and alcohol related? Nate, sounds like that's up your alley.
I guess that does fall into my wheelhouse. I can't really give a actual percentage. It's not a number I've looked up recently. I would say alcohol by far over drugs carries the vast majority of calls that fall in this realm. So those generally tie up, and I would say just citywide, we've had this discussion amongst myself and the other providers. Those type of calls tie up probably the most resources in general is alcohol, just because it ties up usually EMS a lot of times. It ties up the hospital with folks, and then they're referred on. So I think a lot of alcoholism and alcohol abuse stuff generally are probably the biggest volume of calls, over drugs or any other substance abuse.
And do those drugs and alcohol use lead to other crimes in Cordova?
They definitely can. Obviously, alcohol, I think all of us probably, know the DUI is the most common crime that occurs from alcohol use and abuse. But other types of crimes also stem from that. Is not uncommon for assault crimes, especially domestic violence crimes, to stem around either alcohol or other substances. But alcohol is definitely a factor in the majority of those cases as well. And drug use, and more importantly, as has been defined already, drug abuse can definitely lead to other types of crimes when folks are down that road of abuse, as Dr. Utzi described, where they don't care if they destroy their lives at that point because the drugs hold such a sway. They oftentimes will have eliminated their possibilities of jobs, especially in a small town like this. They have burned bridges, and that can definitely lead to other types of crime just to support themselves or even perhaps feed themselves.
Great, thank you. So what should we do if we suspect someone is high on drugs or drunk and we think they may be a danger to themselves or others? Do we call the police before something happens, or do we have to wait until they get in a car or worse?
I'll take that one as well. Yes, absolutely call us if you think somebody is a danger to themselves or others. There's specific statutes in law that allow us to intervene if we have credible evidence to suggest that someone is a danger to themselves. So we'll, no matter what, if you call and suggest that, we will definitely come and look into it. How that gets resolved just always depends on what exactly is going on in that circumstance, but definitely call us. We will, our goal is obviously to intervene as much as we can intervene. We don't want, a crime to take place before we intervene. We'd like to intervene before the crime, if at all possible. Obviously, that's not always the case, but yeah, if you think somebody's going to harm themselves, definitely give us a call. Or they're dangerous to other people, definitely give us a call, and we'll do our best to intervene within the scope that we can. Obviously, the law also limits, and people have rights, so there's a limit to how much we can intervene depending on what's going on.
And I would add in that if you feel like they're a danger to themselves, try to get them to come into either the clinic or the hospital with you.
Great, thank you.
So this goes to the culture that we're dealing with, and we've started to work with Kay, and on our tribal court has been doing circles with the young people that may be getting into trouble, but there's also the aspect of people not wanting to turn in their own family or turn in people that are having problems that because of the stigma that'll go with it, I don't know, but that's another portion of our tribal court that we could, it's all confidential, to work out those things before they become a problem. And so I would encourage the community to look into that and maybe take a use of that for the sake of all the young children that are growing up, watching the older children get into the drugs and stuff. I mean, it's just a whole culture that I don't think we've really dealt with yet so far, but that's what we're doing here now. So,
Thank you. So Hannah, this looks like your question, Dr. Sanders. If someone goes to the hospital with a drug overdose, what happens? Do they get arrested for using an illegal substance? Why or why not?
No, people can seek care at the hospital, and we absolutely do not call the police to get anybody in trouble. Occasionally, if the staff feel that the individual is a danger to themselves or to our staff, we might call for police help. That's more to act as the security guards for the hospital because we don't have those. And the police force here is amazing at supporting the hospital. We really appreciate their support, but we do not call them to come and arrest an individual and charge them with a crime.
Great, thank you. So I've seen people end up at the hospital multiple times because of using alcohol or other drugs, and they're released to go home. Why isn't more done to help them? What should we do?
So I can take the first part of this, and then I think Nate and Barb could help me as well. So when an individual comes into the hospital, we plan to have an assessment done, but initially we treat them. So if it's an overdose, we'll use Narcan or whatever we need to do to stabilize the individual. And then we have to have them clinically sober before we can do any kind of assessment. And the individual has to agree to the assessment. So they also have to participate. We don't have any jurisdiction to force them to participate in the follow-up care. We try to make those connections. We call them warm handoffs. So if somebody's in the emergency room or the hospital or the clinic, we'll try to connect them with the resources here in town. But we do have to have some participation with that individual. It's really neat here in Cordova because we are starting to be able to work with the tribal courts and the Cordova court system to help get some of these individuals help and support. And it really is all of us trying to get people to that next level so that they follow through. You guys want to talk about any of the reasons that we don't hold them?
Oh, sure. I'll handle a little bit of that. Oftentimes when somebody's in the hospital, say for alcohol abuse, obviously it's merely a medical situation and or a self-harm type. They may be a danger to themselves at that point. once once they're sober, they're no longer in a medical situation danger, and they're usually no longer in danger of harming themselves unless they go and abuse their alcohol again. But we can't. That's not illegal to go use alcohol, so we can't hold them once they're out of any kind of danger. Occasionally, they aren't in any medical danger, but they may still be expressing danger to themselves, and we may hold them because we are allowed to under law in our facility so that they can be evaluated, because they may be still intoxicated, not medically in any need of care, but intoxicated to the point where they're dangerous to themselves still, perhaps not able to care for themselves or something along those lines. In those cases, we will hold them. And then often if the doctors feel that they do need some sort of an evaluation mentally, or we try to hand them off, like they were saying, as a warm handoff to sound alternatives or one of the other care providers to try and get them tied in to that care. But obviously, as Dr. Sanders said, they have to have some level of participation in that.
So this question might fit nicely into the clinic with NVE. Isn't giving out Narcan kits and fentanyl test strips just encouraging drug use? I heard a little reference to that earlier in your introduction, so I just want to reinforce that question. And then how is treatment for substance abuse that uses medications like Suboxone different from replacing one drug with another?
I'll take the first, you take the second. All right. Dr. Sanders spoke to this in her introduction, I think. People are already using these drugs. It's just a reality and it's happening. So what we're trying to encourage is that people evaluate the risks associated with what they're doing. So a fentanyl test strip, causes people to pause and let me see how much danger I might expect in this particular episode of use. Simply put, these things can save lives. But beyond that, I think it encourages people to consider the value of their life. And it gives us, whoever at the clinic, whoever interfaces with them, I think we show them we care about you. We care about your life, whether you're using or not. But we're here for you where you're at. And that's a big part of treatment, is meeting people where they're at in their use. And ideally, we catch them young and we prevent this whole thing. That's just not where we're at right now. And so we want to meet people where they're at, and so they know we're here for you and with you, whatever you have going on, and we care about your life. And we hope that they do too, enough to use these resources.
I would also add into that Narcan test kits, it usually takes about, more than 10 times of somebody trying to quit something before they're able to. If we can get them the Narcan test kit to give them those opportunities to get off of it, we can save lives and change lives and actually improve things. As for the Suboxone program itself, a lot of times when people come into the Suboxone program, they are addicted, which is considered a mental illness at this point in time. It's not a personal failing. It's not a personal choice any longer by the time they get to that level. Their lives are basically a wreck. They're having trouble holding down a job. They've oftentimes lost their loved ones and family members to this illness. I look at it as a medication that allows them to gain control over something that they have no control over when they're on the street and using something they don't know what's in it. It's a very metered dose to, avoid withdrawal, and allow them the time they need to rebuild their lives. There are a certain number of people who completely get off of Suboxone. Others may need it as a medication to treat their mental illness for a longer period of time. Also, Suboxone is much, much safer than a lot of the other substances that they may be using. And so it felt like that when I first started researching everything as well, that it was replacing one thing with another. But a lot of times in our lives, if we can replace a bad thing with a better thing, it's a positive change. And that's kind of what we're in the field to do.
Great, thank you. I heard mention of youth, and there's a question here. Does Cordova have a problem with our youth abusing substances? What happens to minors when they are arrested for alcohol or drug use? And do we offer drug and alcohol education in our schools? 3 parts. Anyone want to take that on? Mark, are you doing anything in the tribal courts with young people, with education and?
Mostly through cultural. We have a lot of open for everybody actually to come in and study culture, do art projects, skin sewing, anything that has to do with the creativity of the individual to get them involved in just, maybe a drug-free life or something. And I think it's really important that it starts at that age. I know my stepson, he is constantly involved with like hunting and fishing, and he's, I have high hopes that he doesn't even have to go through the phase that most of us went through. But one thing I'd like to talk about is a lot of these individuals starting in their teens probably having problems with peer pressure, that the substance abuse actually becomes self-medication. I know a lot of adults are into the same thing. Just stop thinking about the things that are really bothering you, and that's what drugs seem to do. Alcohol seems to do that really well too. But so I'm back to the mental and spiritual part of this. That that we really start looking hard at that as changing life, especially for the young people.
Great. And does anyone have any idea of what we do with education, drug and alcohol education in the schools?
So if I can speak to that a little bit. So your first question was, do we think we have a problem with young people and substance use in Cordova? And I don't think there's any good statistics on that. But I can tell you that students at the high school think that their peers have a problem with drugs and alcohol. And so I think that's something to look into. I think it's of concern to them and to their families. And I don't think we talk enough about it here. The school does not have much for drug and alcohol education. There are units in the health program at the high school, but for many years, the elementary school has not been in a position to do any programs or curriculum or prevention. And I think it's a gap here because the research shows, just like Mark was saying, if we can start earlier, we'll have better outcomes.
Great. And then maybe you can speak to the youth if they get arrested for drug or alcohol related minors.
Yeah, absolutely. Minors, definitely for most cases in the court system, are treated differently than adults. Outside of driving offenses, for which they're treated as an adult, every other type of offense, especially if you're talking drugs, which are typically a felony level offense, they're treated completely differently than adults. They're prosecuted differently through a juvenile probation office and juvenile probation officers, and they're handled much differently than adults generally are in the court system. Offered different remedies and solutions in convictions for crimes like that too. Often community work service, almost all the time some sort of drug and alcohol counseling programs. Very rarely, it depends on the crime obviously, but very rarely is there any actual incarceration in a youth facility. That may occur, but it doesn't occur often. Often, especially with the youth, the court even is looking at rehabilitating the youth and trying to offer them a chance to not impact their life so drastically.
Great, thank you. So here's another question. I know there are some services available here, but are there enough? What are the gaps in services from your perspective as a provider? I guess that's all of you could probably run down that. I mean, probably each of you has your own ideas about that. So if anyone wants to jump in.
I'll jump in from the substance abuse treatment perspective. We are outpatient treatment here. And when we assess people who come in for the level of care that we recommend, there's a set of criteria that you look at regarding their risks and relapse potential and supports. so many people fall between, they need more than outpatient, like once a week or twice a week or whatever we might have resources for, and high intensity residential treatment. You know, you go there for 30 days to several months. So that's a tough point, just with the resources available in town, the number of providers, the level of support that's needed. Often we can't quite meet, but it doesn't necessarily fit that somebody needs to leave town, leave their family, leave their life, and go to inpatient treatment. So that's one gap that I see.
I'll add to that a little bit. I think the identification that we certainly don't have those inpatient intense resources, but part of a lot of these rehab programs require a fair amount of group and kind of peer cooperation and the peers progressing through the program together. It's very challenging to find peer groups that are in need of the same services at the same time and get them to sign up and support each other as a group here. So we certainly we'll continue to try to get those groups together, but we'll get better success if we can get them to come together and have a peer group that then can do that intense therapy. To bring us your patients and your peers, and we'll help put the groups together.
So there's a lot of federal money right now with COVID and healthcare, and the tribe has been looking at for years and years trying to get a detox center here, fill that gap. So when I was a kid here, alcohol was the big problem, and I can't imagine what the kids are going through today with the types of drugs that are happening here. It's just crazy that they've just become so strong. How do we even need that? I mean, it's just crazy, but yeah, a lot of services that we need to accomplish, and I think the money is out there now. So if we work together as a city and the healthcare and law enforcement, we have a much better chance of getting those kind of grants and stuff. So I'm really excited about this time.
Thank you.
And one thing that I wanted to add, so Alanka and Sun Alternatives are putting together a group that should start the middle of October. That will be a support group for friends and families of people struggling with substance use or addiction. And I think I want to mention it in the context of Dr. Sanders' comments about the difficulty in helping get groups off the ground, because they really do require that peer support, that willingness to engage. And these topics often have so much stigma that people are afraid to show up and talk about it. Understandably so, because you're very vulnerable when you're talking about those things. But I do think that if we want to impact the pain of the individuals in our community, I want to encourage us to be willing to be vulnerable and take advantage of those services and join those groups and be peer support to each other, because that's really the way people get healthier.
Chief, I don't know if you have anything to add.
Well, I think I'll probably just reiterate what everyone else has said. Is obviously, I think we've come a long ways. In my time, I've only been here 9 years, but I think we've come a long ways in our ability to help and treat folks who suffer from these things. I know with the medical assisted treatment and things like that. Obviously, we have farther to go. I second with the type of some type of inpatient or residential type treatment that low key, not a month long, but the shorter stays. Sometimes there's folks that we deal with who, we refer to them, and that's the kind of thing they need perhaps. And there's nothing really here for that. On our end, I would like to see us renew our drug education in the schools. We had a DARE program in the past. It's sort of fallen by the wayside simply for manpower purposes. Most of the time, we don't have a current certified officer in that, and we wear a lot of hats, and it's a lot of times there's only so many hats we can wear, and sometimes it's hard to take on another thing. But that's something I'd like to see happen again. I think it's a good program to run, at least that, if not DARE, another program like in the elementary schools especially, just to start it early, that education before the peer pressure sets in that often occurs in the older schools.
Thank you. Related to that question is what can friends and family members do to help people with substance abuse disorders? How do I get my family member into treatment, and what do I do if my friend or partner won't admit they have a problem? Is there anything I can do?
I'll start that. I think one thing we forget with our friends and family that might have problems is call them, check on them, say hi, show them your love and support for them. And I think that goes a long way in helping people. You can also let them know about the resources, but often that's not what they want to hear constantly about. So connect them with resources, but show your love and check in on them for the other parts of life that we all need to check in on.
That was the question I kind of wanted to ask. Is there a different attitude and approach now for the care for addictions, people with addictions? I mean, there was a time not very long ago where they wanted them out of the community because they didn't want the family influences affecting that one who was seeking. And I've never understood that, because to me that's part of the problem, is the disconnected that we all seem to be wallowing in anymore, that we aren't connected. And I see that because if we had something here in Cordova, would family be forbidden to participate, to be seen? I don't even know how to word it, because it's so emotional. It's such a thing for me, because my own family has that changed?
I hope so. And I'll add one more thing and then let you, a lot of other places do have support groups for family members that are involved. And that's something that we could work to create here. And in this new time that we have, there's also a lot of meetings and support groups that are available online. So if people are concerned or are worried about being ostracized due to the stigma, certainly can find some support in groups online.
Yeah, so that was the old way of thinking about addiction, was it was a stigmatized thing. It was a personal choice that you wanted to keep using. I think that as time goes by, we're trying to re-educate folks and let them know that it is a mental illness. And on top of that, that it destroys the whole family when it happens, just like other mental illness, bipolar, schizophrenia, those things destroy families. They don't just destroy the individual. Barb Jewell mentioned it earlier, family counseling is definitely a part where we kind of bring families together and try to help them deal with their internal struggles. As a community in mid-October, we're starting that kind of support group for the families through things like AA and organizations like that. There's also Al-Anon and organizations like that that help the families of people in AA. And oftentimes at these larger conventions across the country, they'll bring the family and the individual together. If the family ends up in an inpatient treatment center, oftentimes they'll have at least one, if not 2 weekends, if they're there for a month, where they do bring the family members in and they start to kind of teach people about that. And so I think as we change our thinking process on this, we're getting closer and closer to bringing us together as a community rather than stigmatizing it and pushing people away.
Thank you.
So that's the key to everything, is a worldwide problem of disconnect with each other and old-fashioned ways of thinking. And if everybody in any community were able to carry through with the concept that each one of us are family, the family of humankind. If we were to treat each other like brother and sister, mother and father, grandparents, all these problems would start to fall away. So maybe it's Cordova that's going to start that.
Thank you. Any other questions from the audience at this time? Okay. Here are a couple of questions that are related to, I guess, law enforcement and the courts. How do we keep nonviolent users out of jail, and how can we help people with their addictions and vices so that they don't end up in jail? It's kind of a two-part question, but are nonviolent users of drugs automatically considered to be, if they're using an illegal substance, do they go to jail?
Using, no, I would say if, obviously, somebody typically to go to jail would need to be arrested for a drug crime, and typically that involves that they get caught with the drug on them or with them or in their possession, as it were. That's the so as was said before, I think reference, somebody goes to the hospital who's suffering from drugs in their system, they don't get charged with possessing it because it's in their body. That's not how the law works. The law works with you get charged with possessing if you have it in your possession outside of your body. Currently, in our current climate, with some of the way the Department of Corrections is working, initially upon an arrest for a crime of drugs, usually it's a felony crime, so they are held. They have a bail hearing before a magistrate to decide what their bail and what their release should be. And that is based upon the crime, their history, and a multitude of other factors is taken into consideration for that purpose. They're not necessarily held. Usually there is a monetary bail that needs to be posted of some type. For misdemeanor crimes, currently, most of them do carry no bail. The Department of Corrections does not want people held in jail for misdemeanor crimes. They can be arrested physically and brought to jail. If they're intoxicated, they'll be held till they're sober, or a sober person is able to take care of them, pick them up. But they're not held for a misdemeanor crime. They're typically released, and they have a court date down the road, and as long as they show up for their hearings and take care of their case, that's kind of how it moves forward.
Great. And related to that, question, how come the person who was recently convicted of drug distribution in Cordova did not have to go to prison but has an ankle monitor and can roam Cordova? Why is someone who is charged with a crime not in jail but walking around town? So there's different, one is conviction and one is charging.
Sure. So convictions are a product of the court system. Those are typically a agreement that is come to, unless it goes to a jury, and a jury decides the guilty plea, and in that case, the sentence is then carried out by the judge presiding over the case. But in a lot of cases, a majority of cases, a conviction of record is a result of a plea agreement, or what's called a Rule 11 agreement. The defense attorneys and the prosecuting attorneys come to an agreement on what charge their client will plead guilty to, or charges, and what charges, if they were initially charged with, will be dropped or reduced. And that's a factor of both the lawyers looking at the whole circumstance and deciding what's best for their client on the defense side, and the prosecuting deciding what is equitable for the community based on the severity of what the crime occurred to be. And in that case, they come to that agreement together. They present it to the judge presiding over the case, and the judge decides if it's fair to everyone involved, including the community that might have been affected by that case. So that's why sometimes these cases come to, as it was noted, an agreement where the person is going to serve a period of time on, say, house arrest with an ankle monitor, because we have those services now. We didn't used to in the past. They're available now. But house arrest obviously is still house arrest. That person's on an ankle monitor. They cannot leave their home. It may be for a period of time, such as a year or more than a year. They cannot leave their home unless they get permission from the court to have a reason, medically usually, to go to appointments and things like that. So it's not like it's, obviously it's not jail, but the court leans that way oftentimes, depending on the person's past criminal history. Another factor that's taken into account is what they're pleading guilty to, their conviction of record. So, for instance, if the prosecutor and their defense attorney, the prosecutor is looking sometimes to get a conviction for a drug crime, the defense attorney would be looking to get all the drug crimes dropped and a conviction of a lesser crime that's not a felony. So oftentimes the prosecutor can get a conviction, the defendant to agree to a conviction of a felony drug crime, if it's their first time, that puts a felony drug crime on their record forever. And that imposes other sanctions on that person going forward. Being a convicted felon for a drug crime, it affects you for your life. There are certain restrictions on jobs, there's certain restrictions on purchasing ammunition, guns, weapons, such like that, federal restrictions on you. So there's a lot that's taken into consideration with those sentences.
Great, thank you. And Mark, I don't know if you want to talk a little bit about the tribal court, which is handling these things differently. You're not being convicted, but how do you get into a tribal court as opposed to the normal court system?
Well, we'll come from Nate in the police station and Kay, who gives the youth offenders the option of coming to tribal court. And we've handled quite a few of them, and I think they've been mostly successful. I've seen some of the young people out in the community doing really well. So it's a process that we've taken on and we're committed to, and hopefully the community is welcome to use it as well for Circle to be able to come in and deal with problems that we're having with each other, or drug abuse and stuff too, alcohol.
So then is it true that the tribal court mainly deals with young people, or do you also deal with adult offenders who are in the system?
Well, at this time, it's mostly the youth offenders, but as a sovereign nation, the tribe has different, rules that they can go by. And anybody that needs help, that's what we're here for. We want to do that. And start that dialogue with everybody, that they can find another way of, instead of entering into the court system.
Great, thank you. Here's a pretty direct question. Can somebody get addicted to pot?
Psychologically, yes. Physically, no. So that's the other side of addiction. The physical addiction is your body absolutely having to have it to function properly. So marijuana in and of itself doesn't necessarily produce that for most individuals. There's some case studies that show that it can, but that's few and far between. The psychological addiction, though, is that drive to use more to escape with. And that can definitely be the addiction that happens with marijuana.
Great, thank you. Here's another interesting question. Are men more likely to struggle with substance abuse than women?
Loudly, yes. Quietly, no.
No. And in fact, the rates of women presenting for substance abuse treatment have dramatically increased. Not because they weren't ever doing it before, but because it's been recognized as a problem that affects genders equally.
Great, and here's a question that is specific to our community. I hear that the drug abuse and alcohol rates go way up when the fishermen are in town and is next to zero in the wintertime. True or not true?
Good luck with that.
So I don't think that's true. I think that the reason it is more out in the open when the fishermen are here is just because we have that huge influx in our population. I think that it's still the same percentage, whether it's winter or summer. Also in the summer, we tend to do more outdoor activities, so you see those individuals more and you get to look at what they're looking like at this point. Whereas during the winter, we tend to do more indoor activities and it's a little bit more inside.
And another question, has COVID increased your awareness of substance abuse problems in our community?
I'll take that. For us at the hospital, I don't think it's necessarily increased our awareness, but we are seeing more substance abuse issues because I think it's increased use due to some of the things we've identified.
Law enforcement question. How are the drugs getting into town and how do we stop them?
Good question. I think if you can imagine a way to get drugs into town, that is how they're coming in. I think it varies probably by the season. I think obviously we have had some cases involving the post office, which were, we found and we prosecuted those folks for using the post office. So the post office absolutely does get used. We have a partnership with the postal inspectors in Anchorage, and I have their phone numbers, and we send text messages back and forth. The airport does get used, I think, occasionally, probably not as much as the ferry system does as far as people who want to carry drugs. There's TSA and there's screenings through airports, and while the TSA is not primarily interested in finding drugs, and most of their equipment is not designed to detect drugs, it's designed to detect bombs and dangerous instruments, it can happen through, so there's a risk involved in traveling through TSA. With the ferry, I think is probably the primary way that people who want to bring it here would be bringing it here themselves, and just carrying it on or driving on, having it with them.
And this is related, we have a drug dog. What does that animal get to do, and how often does he find drugs, or she?
How often obviously depends on what we get called. The dog is EAC, it's a male dog. He is trained to identify most narcotics, so methamphetamines, heroines, cocaine, those substances is what he's trained to identify. And we can use him anytime we can establish a reasonable suspicion that there might be narcotics involved. So, if it's via the postal inspectors who have some suspicion and they have good reasons to believe there might be some narcotics involved, be it a traffic stop where we can see things that would lead us to believe there may be narcotics involved, we can put the dog on that. So there's a variety of circumstances in which he can be used. He's had, I guess, several fines this year. He generally discovers drugs a couple of times a year, depending on the number of calls that we get.
Okay, here's another question. Do childhood experiences influence my likelihood of developing an addiction?
Yeah, there's plenty of studies on that. I think there's like 9 steps that are things that happen to young people in their early life that definitely increase the possibility of addiction and other behaviors as well.
Yeah, I think what you had mentioned about disconnection, I think those adverse childhood experiences and trauma creates this disconnection. And then if there's a drug or a substance that can make you feel better, Mark mentioned the self-medication, that combination is super risky. And, the hopeful thing is, even if people do experience the adverse childhood experiences, if they have supports and mentors, then there can also be a resilience through it. So I don't think it's a necessary outcome for every person, but it does increase the likelihood that that combination would become a very high risk for addiction.
Great, thank you. I understand that there are drugs that are synthetic or not pure, which is why we're using the fentanyl strips. But are those being manufactured here in Cordova, and how do people recognize them?
We don't have any indication. Obviously, they could be. I don't know that they are or not being manufactured here. My suspicion, at least recently with what we've discovered, is that they're not being manufactured here. The press release we put out before, as it indicated, what we did discover, at least earlier this year, were some very high quality pills that were deliberately, intentionally manufactured to look exactly like a prescription drug. Although they contained none of that prescription drug. They were simply fillers and fentanyl itself, pure fentanyl. So I would say definitely in that case, at least, they were manufactured somewhere in a high quality facility. Where that may be, we're not sure. There's indications nationally that some of this stuff comes in internationally. I think there's probably strong evidence to suggest that a lot of it does get manufactured in other countries, in third world countries especially, where the risk of prosecution is low and the supply is available. So.
And I'd also like to point out that all illegal drugs in the state of Alaska are synthetic.
So So this isn't a question, but this seems to indicate the reason for those fentanyl strips is to really determine whether a drug that you're using, you cannot be sure that it is what you think it is. And that seems to be the case. Does anyone want to add to that?
Yeah, there's no regulation at all on these substances that are coming in. None.
Most buyer beware.
Right. Most of our medications and things that we prescribe go through a very rigorous testing study. If it's found that anything's abnormal with them, we pull them from the market. That's not done with these particular things. And so they mix them with anything and everything in order to cut the drug, which is a term meaning to basically increase its value by making it slightly less potent or mixing it with something that's more potent in order to increase the effect and sell it for more money.
Yeah, and I'll just reiterate on that, the fentanyl strips obviously could be used to test, like in the last case, it was pills that looked like a legitimate prescription pill, but they weren't. Another common practice to use fentanyl to, as Dr. Yutzi was saying, cut or add to a heroin product. And so heroin obviously is manufactured by folks. It looks differently depending on how it's manufactured. But if you started adding other things there that decrease the potency of heroin, one of the techniques is to add fentanyl to it. So these test strips could also be used by users to make sure that their heroin doesn't have fentanyl in it, because obviously if it did, it would pose a very dangerous risk to them of overdosing. So that's part of the reason that they're available to folks, as our other folks in the hospitals are saying, is to try and not have them die from using their drugs. We don't want that to happen to anybody, so that's why they're available in the community.
Okay, and here's a question related to death. If someone overdoses, how fast do they have to get to the hospital, and under what circumstances would they die before they could get treatment?
We want them to get to Narcan before their heart stops and before they stop breathing. That can be different for everybody and different depending on how much medication they got. One of the scary things is the drugs usually last longer than the Narcan lasts. So they need to give that initial dose of Narcan and then come into the hospital so that we can continue to administer the medication that will give the individual's body time to process off the drugs.
And that's why most Narcan kits have 2 doses, is because one is usually not sufficient.
So if someone's overdosing, the Narcan will buy you time to get them to the hospital, but the important piece of information is get to the hospital because it doesn't solve the problem. Okay, great. So we've been talking about family members and what to do, but if someone personally wants to get help for their substance abuse, where do they start? What can they expect as far as the process to get started with treatment here in Cordova? I hear the waits are long.
I would say start anywhere with any of us, and we'll try to connect you with the person, program, solution that suits you the best, that's going to help that person be successful.
I would agree that at times, certain avenues, the wait time is long, but there's going to always be an avenue for you to get into, whether you make a medical appointment, whether you make a psychiatric appointment, psychological appointment, or whether you just come in the front door at either CCMC or Alanka. We will see you.
Even if we're running with big wait lists and limited resources in town, we always try to screen for the risk. And if there's suicidal ideation, we're getting you in. If there's drug use that is risky, alcohol use that is risky, we're getting you in. So it is kind of triaged. That's a high-risk area. And we want to see people as soon as we can. And as far as how do you get started, whoever, wherever you access, just have a conversation. I think it's that simple. We're all here to help facilitate that, not to judge anybody, but just to help people get what they need and what they deserve.
One of the avenues that they might not think about is going to the recovery circle or AA. There's a lot of people in those groups that do understand how to get the person connected and are willing to work with that individual to get them in.
AA and recovery circles how do people access those in this community?
For Recovery Circle, it's Tuesday nights, except for tonight and next Tuesday, starting back on September 28th. It's at the old DMV, the basement of Alanka, the Wellness Center, and you just show up. You don't have to register. You just show up at 7 o'clock and they meet. And AA, I don't know if anyone knows AA.
AA is in the old like Sunday school room of the Nazarene Church. You just pass the Catholic Church on the right there. It's on the left in the blue building.
And on a particular day or time?
On AA is Monday, Wednesday, and Friday at 7 o'clock.
Great.
Yeah, and I just want to add to that just what they said. It doesn't matter who you go to, somebody will get you connected. I think in terms of being prepared for the process, it is what Susie was saying. There's going to be some questions to ask you to screen for risk, and high-risk folks get services regardless. And then even if there are some services that need to be waitlisted, I think this is probably true for both clinics, but we maintain contact until we can get them into full services, or we get them connected with someone else. So that we don't want anyone falling through the cracks.
Great. I will give one more question and then again look to the audience if anyone has any other specific questions. But if a family member has a problem, seems to be struggling with drug or alcohol in our home, do we call the police or do we put them in our car and take them to the hospital?
That would come down to whether they're a danger to themselves, others, or whether they are willing to go to the hospital. If you can convince them to go in, that's probably the best way to do it. But if they're a danger to themselves or other, please call Nate.
Okay. And can I add a little bit to that? Because earlier in the conversation, there was a question about if I have a family or a friend that I'm concerned about, how do I talk to them and how do I get them into treatment? And Dr. Sanders talked about, remembering that they're a whole person, they're not just their use. And so really you want to check in with them. How was your day? How was work? How are you doing? But also being able to say, I'm worried about you, and here's why. I'm afraid about these things. Making sure that we use I statements and no blaming, not you did this or you didn't do that. There's a couple of pieces of information out in the hallway that has additional information about that. But I think it also speaks to the comment that someone made earlier too, is that the person has to be willing to go to get help or treatment. And there's absolutely nothing anyone can do if they are not. Even when the courts order them and they actually have to physically go somewhere, it's typically unsuccessful if they are not willing. So remembering, I think that's where those support groups and Al-Anon and things come in, that it does affect the whole family. It affects friends. It affects everyone. So part of what a person can do if they're concerned about someone else is they can demonstrate how to be healthy and take care of themselves, and making sure that you do that while sharing your concerns about them.
Great, thank you. Well, I have exhausted this list. We're at 20 minutes to 7. I don't know if there's anyone in the audience that wants to ask a question. Here, let me get you a mic so you...
Okay, the one part that we haven't touched at all is somebody walks through any of the caregivers' doors and they haven't a clue how to deal with the financial end of things. How is that dealt with?
That's a great question because we talk frequently at all our facilities about what a barrier that can be for people seeking any kind of health care, much less mental health or substance use care. So I'm really glad that you asked that question. At all of our facilities, and I guess you guys can jump in if it's different, we have processes for helping people with that financial burden. So certainly, first of all, we bill insurance. And all the facilities pretty much take all the insurances. For folks who don't have insurance, both facilities have folks who can help you sign up for insurance, whether it be Medicaid or one of the federally facilitated marketplaces insurances. So we can often help in that way. Both facilities have sliding fee scales, which means that based on people's income, their rate of payment will be reduced. Payment plans get made. We help people write grants for funds. It's not that it will never cost anything, because it probably will cost something, but there are lots and lots of resources, I believe, at both facilities to assist with that piece of it, because the finances can be a burden and can really interfere with seeking treatment or participating in treatment.
One of the other things I like to remind people is, how much did you spend on your drug of choice over the last month?
All right, well, I want to thank everyone for being here in the room and those who are listening on YouTube, and especially thank our panelists tonight. It was a very informative conversation. I learned a lot, and I hope all of you did as well. I believe we can count this as one of the first of a series of things that we can do to pursue solutions and get information broadly available to the community. And again, thank all of you tonight for being here and being part of the solution in our community.
I'd just like to make a statement now. So the world is a really scary place right now. There's so many crazy things that are happening. So think back to your adolescence when you were a young person and how confusing things were. And what am I going to do with my life? And, you know, there was all this stuff that you had to work through. And then pretty soon you went into maturity and you started to understand some of the things that you thought you knew back then. So humanity's going through that. And it is if you realize that, and you take care of each other, like here in this community, if we really start to unify and take care of each other, we can alleviate a lot of the pressure off of the young people. And there's really a problem with getting some people for mental health is a really big problem here too. I mean, we were just a small town in like a barnacle on a rock back in the old days, and everybody drank, and then, you know, it wasn't that confusing. But now there's so much happening, and just try and take some of that pressure off of yourself and put it towards service to other people, and that is one of the solutions.
Well said, thank you. Would anyone else like to make a closing comment on the panel? If not, we are good. And again, thank all of you for joining us, and we look forward to future conversations.